Nurses of psych wards, what did a patient do that left you speechless? Probably the saddest was a resident I had a long time ago. This gentleman was a WW2 vet with Alzheimer's and dementia. Probably once or twice a month he would relive some battle he was in. He would literally run up the hallway and grab you and yell at you to get down behind the sandbags. He would then tell you take his Thompson because it was too heavy for him. He would just use his pistol. Then he would get up and run back down the hallway. This guy was old, and seeing him run full sprint like that up and down the hallway during one of his episodes was surreal. I can't imagine having to constantly relive the worst moments of your life where you witnessed and survived the unspeakable horrors of war. In such a situation, would it be wrong to play along? Dealing with ALS patients, you never tell them no. For example, if they talk about their dead family, you don't ever tell them they're dead, because they can literally go through all stages of grief, until of course they forget again. So in situations like experiencing old war scenes, you don't exactly tell them the war isn't happening, but you steer it in a softer direction. We had this one old lady at the nursing home I worked in with Alzheimer's. She thought her wheelchair was her car, and she would regularly stop in the halls and ask for directions. We would give her directions, sending her in a big circle around the facility, and she would motor off, happy as could be, singing with the radio. One of our patients escaped the ward and managed to hitchhike all the way to Sydney, about 900 kilometers. And this is why I don't pick up hitchhikers. In Australia, where you shouldn't pick up anything, a nurse told me one of her patients killed himself on the unit while on one-to-one suicide watch. Edit. Patton and staff were at arm's length, and patient suddenly charged the wall, smashing his head as hard as he could, breaking his neck in the process. I've cut 2 patients down myself. Yeah, that'll mess you up. Wait, what? Cut down from a noose where they hanged themselves. Oh, what a relief. Patient *, I'm gonna kill myself *. Nurse *, not if I kill you first, amigo *. We had a geropsych floor. Crazy old people. One night while passing through, a little old lady popped her head out her doorway and said to me, "I could sure use the company of a good-looking young man tonight." Quote, "Sorry, I'm not that good-looking." Quick as snot on a doorknob, she said, "That's okay. I can't see too well." I didn't join her, but her charisma was on point. Sounds like you're the one who missed out in this story. I watched a guy try to remove rats from his rectum. Monsieur stated that his ex-girlfriend summoned them there. He ended up tearing his rectal walls to shreds. Had a catatonic guy who could play the piano like a pro. Classic. Jazz. Ragtime. But otherwise just sat in his chair and stared. Not a nurse. Pharmacist. Had one of our clozapine patients miss a monthly meeting to discuss their medication. Called around. Found out she was in the ICU having eaten 2 of her own fingers, then visited her mother for coffee. Still bleeding. Had a friend tell me of another patient. Made a cut in his thigh and reopened it regularly until the whole thing was a scar tissue cavern. By some miracle avoiding infection. Started using his meat pocket to hold pens and coins and anything he could collect in his ward. Nobody knew until a paperclip pierced the side and he finally wound up with an infection that took him to ICU, where they found his stash. Meat pocket. Jesus, dude. When I was in nursing school, I had a clinical in the state-funded PSYC ward downtown. I was assigned to sit with this one girl to monitor her behavior. She spent about 30 minutes doing nothing but eating pudding cups with a plastic spoon. She ate like 6 of them in half an hour. Then, out of nowhere, she very calmly licked her spoon completely clean and pulled her shirt sleeve up before shoving the entire spoon into an incision in her arm near her bicep. Then very calmly said, "Oops." The nurses that worked there didn't believe me. They kept saying I was making it up and that I couldn't have seen what I saw. Only later on, like 4 hours later, it was a 12 hours clinical. The orderly noticed the girl had some blood on her shirt. He took her into her room to change her clothes and noticed that an incision on her arm had been bleeding. Then eventually agreed to send her to the hospital for testing. The X-ray showed the entire spoon sucked into the fat of her upper arm through an incision where they'd removed a birth control implant in the week before. Apparently the girl had slowly been picking at the sutures and opening it bit by bit until it was deep enough to fit an entire plastic spoon. The girl admitted that the OHPS was because it had gotten sucked in and couldn't be pulled out. Not because she stuck a spoon in her arm, monsieur. Totally bizarre. Not a nurse, but I used to be a security guard in a hospital, and we had a patient who self-harmed and cut a hole into themselves around their belly button and then stuck a bunch of paper clips and buttons and things like that into it. This reminds me of a sequence in Alfred's Playhouse. That behavior is one of the most severe indicators of abuse imaginable. Edit. I encourage those affected by childhood abuse comparable events to look into Pete Walker's resources on complex PTSD. Don't do what I did and take a bunch of mushrooms, lol. We had a psych patient on our floor that wasn't really crazy. Just really confused and unpleasant in general. One night I was mixing his drink with some thickener, and per usual he started yelling about me poisoning. Hi monsieur, I explained what it was and that we're all here to help him, not hurt him. And he responds with, I'm just going to die. His vitals were fine. He was alert. No red flags. And like I said, he was always pretty unpleasant, so I didn't think much of it. Sure as shit, he coded an hour later and we never got him back. Edit. Coded is slang for code blue, which is what they call over intercom pagers when someone's stopped breathing, or their heart has stopped. My man said peace out and fucking faded. The commitment of the lad. You can't kill me, only asterisk I asterisk kill me. Psych ward counselor here. Early in my career I had a teenage girl with suicidal ideations and severe depression. The year before, on Thanksgiving, her dad pulled a gun from under the dinner table and blew his brains out in front of everyone. I normally form a response pretty quickly, even a wow, but when she told me I got quiet, leaned back, exhaled, and had to gather my thoughts. My sister was actually sectioned earlier this year for her eating disorder. She shouldn't have been, but that's a story for another time. And she was right next to the PICU, Psychiatric Intensive Care Unit. One of the nights she heard multiple screams coming specifically from that ward. One of the patients had bit a chunk out of a nurse's leg as they were trying to detain them. They then started eating said chunk. It's crazy to think these types of things happen. Edit. Sorry guys. I typed psychiatric instead of pediatric. She was only 15, so it was PICU. I just had a bit of a brain confusion. Sounds like they too had an eating disorder. Not a nurse, but I was a patient in a psych ward. The ward was sectioned into two sides based on case severity. I was on the less severe side. One night, an incredibly tall, somewhat muscular man escaped his room on the severe side, got through a door that was supposed to be locked, got into the less severe side, and into my room. Monsieur, I woke up, sat up, and saw him standing in my doorway. He asked in a shaky voice if I was alright. I hesitantly said yes, to which he responded by getting a look of terrified horror and screamed, I knew it. You can see them too. Don't let them get you. Before he was dragged away screaming by security. Guess you're a protagonist now. The sad thing is, he really seemed to care for you. When I was a student doing a placement in a max security unit, a serial rapist was getting meds. Made a silly joke. The nurse said, oh, stop that. His response was, I've heard that before. We had a psychopathic rapist with reinforced delusions of grandeur. He was obsessed with a female nurse, convinced that she fancied him back, but her job prevented them from being together. When told that this wasn't the case, he thought that the male nurses fancied her and were jealous of him, and the female nurses wanted him for themselves. He would try to seek her out alone. Once tried to lure her to his room where he had a barricade waiting to block them in while he raped her. He admitted this, but insisted that it would have been consensual. That failed, so then he tried to get her fired instead with accusations. He bit himself and scratched his back, blaming her for the masseur. The idea of that guy getting out still terrifies me. He has no remorse about any of his past crimes and basically thinks that the victims were lucky that he abused the masseur. Jesus, that one hit me. Was interviewing a guy in psych ward and he was complaining about how he couldn't have any white out, a liquid eraser for typewriters. Bekassu, he was on suicide watch, claimed it was stupid Bekassu if he wanted to kill himself. As he pointed out, he could use the drawstring from the blinds to hang himself, or he could use his pencil to stab himself, or use a typewriter metal bar to off himself. I agreed it was silly to hold back the small bottle of liquid whiteout. When I relayed the convo to my instructor about how silly it seemed due to him having several other ways, she replied that he proved to me that he had been considering ways to kill himself, and that's why he was able to come up with so many so quickly. He never did get his whiteout. I visited a prison for a warden job and went to see the constant surveillance guys for their own safety, etc. There was a fella there who had used a razor to slice his stomach open and started pulling chunks of himself out for fun. He also started using the hole, which wouldn't heal, as a hiding place. A towel was found stuffed in there which his body had started fusing to. Apparently he was quite nice, but the whole thing wasn't for me and I didn't go ahead with applying. Edit. For those posting that happened, I suggest reading this topic and doing research on what seriously ill patients can do to themselves. If you think I'd make this up. How the fuck did he get a towel in there? Question mark. I never asked. Had a nice conversation that same day with a father and son, both in for the same murder. Weird how one act puts these people away, but if you didn't know, you'd just say they're nice people. Not me, but my dad used to work in Airedale and J Ward, Australian insane asylum and prison for the criminally insane, respectively, in the 70s. He used to talk about sunny days in J Ward where they'd bring out all the inmates during a sunny day and they'd promptly line up and start jacking off. In Airedale they deal with the jacking off problem by strapping you into cotton mittens. But a lot of the inmates would chew a hole through them just to get a finger out to jack off with. His worst story was about a psychotic woman in Airedale. She had self-inflicted scars all over her face from scratching herself, self-imposed bite marks all over her body from trying to eat herself, and she had a nasty habit of chewing the inside of her mouth and spitting blood at your eyes and mouth, hoping you'd catch one of the myriad of diseases she carried. I've worked with so many people who spit blood in your face when they're pissed. At first I was pretty impressed with the clever thinking, but now I just get annoyed that they're staining my clothes. Do you get paid a lot? You should be getting paid a lot. I mean a lot. A ton. You should be getting paid more than most people. Nope. I've been a psych nurse for almost 10 years in the UK and I get paid £30,000 a year. And I plan on funding my retirement by writing a horror novel inspired by what I've seen over the years. I'm not a nurse but was a patient once. Giant dude got upset. One dude changed the channel from a football game he was watching and smashed his skull with his fists. Not fully, but enough that when they brought him back a few days later he started seizing and had to be removed again. Didn't see him again. Also, there was one lady who was straight out of the movies, walking around preaching the end of days loudly and sweating like crazy. This might not fit perfect, but I love this story. How about in an inpatient addiction clinic? The first one that comes to mind was something I witnessed between a patient and another floor tech. We had a man who was in serious detox. Drug of choice was meth. He was throwing a huge tantrum. Not uncommon in DTs. People will do just about anything to get a fix. We weren't a locked facility, so it wasn't like he was stuck there. He genuinely wanted help. That's why he stuck around. And we were there to listen and help him through the shakes, hallucinations, and other symptoms. He was slamming his fists on the desk at this point, and he had started just yelling, "I just want some fucking ice." Quote, slang for crystal meth. Well, the tech with me was inexperienced, although much older than me. And while I talked to him and tried to calm him down, she went back to our staff kitchen and got him a glass of ice. Like frozen water. She brought it out to him and put it in his hand like, problem solved. And the guys just froze with confusion, staring at it. The patient and I both realized at the same time she thought he wanted ice, and we just started at each other and started laughing. He was in for a rough couple of days, but I've never seen someone jump from near psychotic episode to giggling so fast. I honestly would have done the same thing as the nurse. Thank you so much for watching and have a good day.